Good morning. Good morning. Welcome to the Mahogany Circle of Hope podcast. My name is Amita Hassan, and I am one of the members of the Mahogany Circle of Hope. My co host is Gloria Bryant. Gloria, would you like to say hello this morning?
Good morning, everyone. Thanks for tuning in.
Thank you, Gloria. And we also have one of our board members, Lois Johnson. Lois, did you want to say hello?
Yeah, good morning. Nice to see all of you. Looking forward to the presentation.
And thank you very much, Lois. The Mahogany Circle of Hope Tacoma, we are a cancer support group. Our mission is to educate the African American community, to promote hope and wellness to newly diagnosed patients and supporters. We serve all people. Our support meetings are once a month, the second Thursday of every month. We gather and support one another, and what we also have guest speakers. Today, we have two beautiful ladies with us today from the multi-care health system here. And the topic will be cancer clinical trials with equity. But first, we'll do brief introductions and then we'll start our interview. So today we have Erkwandra Joseph, and we also have Stacy Macon. Thank you today for coming to be with us. Did you want to just say hello briefly?
Hi, everyone. Thank you guys for having us.
Oh, thanks for having us, and I look forward to having this discussion with you.
Thank you so much, ladies. We're excited. This is a area that I don't have that much information on, so I am very excited to learn what I can. And our aim also with Mahogany is to make sure we have information and resources available to the community. So once again, thank you. So we'll go ahead and get started with our interview today.
Good morning, everyone. Again, we're just going to jump right into it. Uh, I want to start out by asking the two of you, what is your professional title?
Yes,
Erica, you can go first.
yes, ma'am. Yes, you guys feel free to call me E. I know that's a lot easier.
Yeah.
But my professional title, so we work at Multicare's Institute of Research, and so I am the first ever diversity and community engagement coordinator. And I'll let Stacy go ahead.
The research engagement coordinator, it's a role that we just recently made here at Multicare. We kind of just reach out to patients and get them more involved with research, kind of educate the underrepresented patients.
Oh, okay. Define MPH.
Yeah.
What is that?
Oh, so the MPH on my title, that stands for Masters of Public Health. So I earned my master's last year at Eastern Washington, and with a focus in health equity. And so that helped me get into this role and partner with the community to raise the awareness of health equity efforts.
Oh, great.
Okay.
Stacy, you have anything? No?
Um,
Matt, oh, I'm sorry, go ahead.
no, go ahead, Gloria. I didn't know you had asked. Go ahead. That's what I was getting
No, I
ready to
was
ask. Go
just going
ahead.
to say, since we have them both here, if
Yes,
one answer and the other one wants to jump in and answer, that's okay. So,
absolutely.
Yeah, so I got into this role because I do have many years of oncology research experience working on clinical trials.
oh,
Okay.
great.
Okay.
Is
Um,
this on all, just before I forget, is this on all types of surgery, the research? Or is it
The research,
specifically?
it's mostly on all cancer types, but it's most of the trials are like chemotherapy trials.
okay.
Okay, sorry, Anita, go ahead.
So, Stacy, what are the requirements for your position? And then E, you can kind of piggyback off of that too. E, you said you went to the college. Stacy, is that required for you also to do what you do too? Is the
Yes, also, but also you can also have research experience or oncology experience. It's more helpful to have oncology experience so you know the terminology and the background of oncology.
mm, okay.
But you
And
don't
also,
necessarily have to have a master's or something in that.
Not necessarily a master's degree, no, not for this position.
okay. Um, as an MPH, what are your duties, E?
So, specifically within this role, I've been able to utilize my community outreach skills. So that's been really helpful. And then, of course, knowing about health equity, knowing the disparities that really play a role in each community, that's been very helpful. So it's not required to have an MPH for my role, but it has been helpful in understanding the community needs and going out and how to communicate with different people. So
Absolutely. And then piggyback again, Stacy. What specifically are your duties? I mean, I know it's oncology, so just give an example. How is your day?
My duties are I will reach out to patients and kind of go over clinical trials with them, ask them what their views are on clinical trials and research. If they don't have much knowledge of research, kind of educate them about what a clinical trial is from phase one to phase four, kind of ask them if they're interested in knowing about clinical trials here at Multicare. If they are, then I'll go back to the research team and see if we can find clinical trials for them. If we don't have anything, then we reach out to other organizations that we're partnered with in the community to see if there's trials available. Just kind
Thank
of
you.
basically offering any additional resources they may need.
Okay, thank you. Gloria?
So can you define cancer research clinical trials? Let's do pancreatic. Do they do clinical trials on that type? I know that's kind of a difficult one.
Actually, yes, that is one that one of the pancreatic trials is one that I actually focus on in one of my roles because that is a cancer that is very hard to treat and
Mm-hmm.
yes. So there we do have a lot of clinical trials there at Multicare. Most of them are like phase three, meaning they've been through a certain amount of patients and they've shown to be effective. So we move them to a phase three. And also we have phase one trials that have been tried on patients for the first time.
I
and
asked that because I know that uh, they've upgraded or they have a lot of new things for pancreatic that they didn't have several years ago. I just recently heard that someone had surgery and on having a portion of that their pancreas removed. I didn't hear that years back, so that's why I was just wondering. I think they've come a long way with that.
Oh
Mm-hmm.
yeah, they have. Pancreatic cancer is one of those ones that's kind of when you find out it's a little too late, it's late stage.
Mm-hmm.
So for someone to catch it earlier on, they're able to get a surgery, which is called a Whipple,
Mm-hmm.
and that's helpful.
Great. That's good. That's good news to hear.
It
Yes,
is.
ma'am.
Miss
Could
Gloria,
you
if
go?
I could define cancer research for you guys, if I think that would be helpful too,
Mhm.
it's important to know that cancer research and clinical trials they're different, but they do play a role within each other. So the way we define cancer research, it's like a scientific study. And it's aimed to understand the cause, prevention, diagnosis of cancer. And then they also, along with that, test different treatment options as well.
Mm-hmm. Mm-hmm.
Thank you.
Interesting. Back to you, Stacy. You said the Whipple. What is the Whipple?
Just a resection of the pancreas, like you were stating, that surgery to remove some of the pancreas.
Oh, wow. Okay. All
Yeah, that's
right.
amazing.
Mm-hmm. That's good to know.
Yeah, really.
Yeah. especially with that type of cancer. You're right. Usually when people are diagnosed with that one,
It's too
it's
late.
like fourth stage and
Yes, ma'am.
hmm Thank you. That's good information to know.
Mhm.
Gloria.
What does the data show about inequality? About inequality. What does the data show on that? Inequality
So
data, you guys.
inequality when it comes to research or the clinical trials, is that what you're asking about?
Mhm.
Okay. So we know that from research and just data from different trials, not just at multi-care, that the underrepresented population, BIPOC, Black, Indigenous, people of color, and then even women are highly underrepresented when it comes to clinical trials. So unfortunately, because of that, that's where we start to see a lot of the inequalities at, because we know that we're all made differently. And so medicines and treatment options will react differently to us. And so that's why we were put into these roles, because we're trying to level out that inequality.
And
So
how long has Multicare been doing this research of inequality? How long has this been a concern that we need to start doing? Our health system needs to start doing something about it. So how long have the research been um, in
in
progress?
So I can say I know that this has been a concern for longer than the project has been existing. But the project has been existing, I want to say about 2 years, right, Stacy? A little over 2 years. So it's been an ongoing project and it's still ongoing. And hopefully we keep it ongoing.
hopefully,
Hmm.
hopefully a lot of politics there.
Yeah, it is. Yeah, it is. Um, I was just gonna let it flow this morning, but I was wondering, did you have your presentation available? And then maybe we could ask questions from that. Um, Team, how do you feel about that?
Sounds good to
Sounds
me.
good.
Okay, and how long is it? About 5 minutes?
Yes, my presentation is long. I can kind of jump to the important stuff, really, was just like that shows the statistics. I think that's a little bit more interesting and it kind of really highlights
Okay,
the bigger picture.
okay,
Yes.
okay. We can appreciate that, and then we'll continue with the questions. Okay, is that
Yes.
okay?
Yes, ma'am.
All
So
right, thank you.
let me see. So how should I pull it up? Just share my screen?
Oh, we need Mary, and Mary left, huh? Did she leave?
I
Are you
think that'll
still there,
work.
Mary?
Yes, I'm still here, but I think E needs to show her screen, share her screen.
Mhm.
Yeah.
Okay. I just sent.
Okay, I have to allow E to do it. So I'm gonna click the button allow.
Yes.
Okay.
Okay.
Awesome. Okay, here we go.
Okay, do you have it now?
Yes, ma'am. And I
Oh,
am
fantastic. Okay.
nice and easy. Nice.
Thanks, Mary.
Hmm.
Awesome. Do you guys see my screen here?
Yeah.
Okay.
Yes.
Yes.
Sorry. That's not what I'm trying to do. It's covering up a part of it, so it's making it a little harder for me to see it, but that's okay. I'm making it work. So just like going back to like the data, so this is national data. This doesn't just represent multi-care. So most of the information that we collect comes from the National Cancer Institution. And so they're the ones who've been pushing the whole recruitment of BIPOC participants in clinical
Hmm.
trials. So as you see this bigger picture here, so 80 to 90% of clinical trials are made up from white participants, predominantly white males. In the US, back in 2020, people of color made up about 40%. So we made up about half of the US population that participates, and then less than 25% were BIPOC, less than 25% of that 40% of people of color are participated in clinical trials. So as you can see, there's a lot of
Big gap.
big gaps here. Yes.
Mhm.
And this is data from about 5 years ago, but unfortunately, we still see that it's still the same way. Um, if we wanted to talk about our community specifically, again, back in 2024, so just last year, 50% of clinical trial participants were white, predominantly, again, white males. Although the Black population made up about 12.47% of the total US population, we only represented about 5 to 7% when it came to clinical trials that were specifically for cancer. So we can see we're highly underrepresented when it comes to
Right,
clinical
right.
trials.
Absolutely. Absolutely.
I just wanted to ask if the trials are offered to all the cancer patients that come through. Is that something that's offered, or is it a certain type of cancer that they would have that they would be offered to? Like I know when I went through my breast cancer, I did a clinical trial. But I'm just wondering if that's something that's offered to any cancer patient that comes through multi-care up and well, you wouldn't know about that one, but any multi-care, the cancer center.
So a patient on the back end side of working on like the clinical trial side, we would screen a patient to see if they meet the inclusion exclusion criteria for a clinical trial. If they do not meet those requirements, we don't approach the patient about a trial. So that's where the gap is. Patients aren't knowing about clinical trials because if they're not eligible, they aren't being approached for a clinical trial.
Okay, Stacy, I got a question on that. That's why I
Yes.
wanted to, I got a question on that. Could you repeat that for standing? What is the criteria to offer a clinical trial?
So each clinical trial's criteria are different. So
Okay.
one could be a patient has to have a certain lab value, or they couldn't have surgery before, or they couldn't had a certain treatment before. So each clinical trial is different.
Okay.
Yes.
Okay.
Is it true that some of the clinical trials offer a stipend or something going through the trial? I know all of them don't. I didn't get one, but I did hear that that's available. Is that true or not true?
That is true. There's different kind of clinical trials. We do clinical trials that are for treatments. Some of those trials offer the patients stipends every visit. So every time they would come in, see the provider, have a treatment, they would get a stipend. And then also we have like early detection of cancer trials, like they're just
Mm.
one-time blood draw. Those offer
Mm-hmm.
stipends
Oh,
also.
wow. Okay.
Yes.
That's good.
Good to know too.
So
I
it's
think
different categories, you
yeah.
know?
Yes, ma'am. Yes.
One shoe doesn't fit all feet. So that's interesting. Okay.
I think that kind of also really helps when we think about the disparities when it comes to participation in clinical trials. We know that specifically within the BIPOC community, a lot of times the disparities we see are it's hard to get off work, or it's hard to find childcare. So I can't participate if I have to be somewhere, every other week or things of that. And so I think that kind of highlights why we start to see those low representations. So, knowing about the benefits that can come or how hospital health systems are helping, recruit and do things like that is great.
And also lack of trust in clinical trials for historical reasons.
Absolutely. That's a
Yes.
barrier. Yep. Lack of trust.
I
Yep.
think that's a big
Absolutely.
one.
Mhm.
Yep.
We found
Absolutely.
a lot of patients that they say they don't want to be like a guinea pig, or they
Mm-hmm.
want to be a
Mm-hmm.
lab rat, or
Mhm.
drugs to be tested on them.
Well,
Absolutely.
they have their reasons for that. I mean, especially if they're older
Yes,
Mhm.
ma'am.
patients that you're dealing with.
Okay.
Yeah.
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 Well, we just kind of explained to them that clinical trials are heavily regulated by the IRB, which is the Institutional Review Board. So they're constantly checking and making sure everything that we're doing is ethical. And if you're on a
Mm-hmm.
clinical trial, you're watched very closely.
Mm-hmm.
Well, my question to that, on the clinical trials, once it's over, do they follow you up, like years after, just to see if there were side effects, or if, you know, something happened down the road, or do they do follow-ups to that?
Yes, ma'am. Most clinical trials, we once we give you an investigational drug, we want to make sure we want to take follow you for a year or 5 years. It kind of depends on each trial.
Mhm.
And
So
that's where
what's
the
that?
data comes from. That's where they get their good data from. So
Yes.
So that was going to be my next question. The length of the trial determines which cancer, or um, is it just for a year, or is it specific? Okay, we doing pancreatic, so we gonna follow them for three, or what are the guidelines for the client being in the research, and what's the estimated length that of that commitment? I guess that's what I'm asking.
Well, I guess this kind of depends on the phases of a trial. Like I mentioned, phase one is kind of first time treated in patients. So it's kind of the patient's like kind of last resort. So it kind of depends on each clinical trial and the sponsor, what they want to collect from it. So each one's different.
Okay, all
So
right.
I'm wondering about the clinical trials. Is this like when the patient goes to the doctor and the doctor say, we don't have any treatment for you? Is this when they sometime are offered the clinical trials? They've said, you exhausted all means
Good
that we
question.
have. Is this when the clinical trials come in, like myeloma? I'm not saying it right, but that's a good one.
Mm-hmm.
Cancer, is that one that they said, okay, we don't have anything else to offer you? And then would you come in and say, well, we have clinical trials that if you want to try, or are they at that stage?
Yes.
Go ahead, I'm sorry.
Depending on what clinical trials we have available, and like I said, the criterias are different. Some of them don't allow you to have certain treatments before. So it just kind of depends on each clinical trial.
but I also think it's important to know that self-advocacy is really important. So just because your doctor hasn't offered a clinical trial to you doesn't mean that you can't go in or do your research and find your own trials.
Mm,
And I think that's also something that we don't talk about too much when it comes to our community. Like I'm bringing the information to my doctors is not something that's commonly done. Uh,
mm-hmm.
so I think that's something good that we should highlight a little bit more.
Absolutely. Absolutely.
There's so much
It is.
with the cancer. I mean, when you get that big word, it's still a scary
Yeah,
situation.
absolutely.
Mine was 16 years ago, and it's still like it's scary when you hear it, because
Mhm.
you just don't know. So I know they say
Absolutely.
breast cancer has come a long way.
It has.
Really don't hear about trials for breast cancer, but I'm sure that they have them.
Mhm.
But you don't really hear that. I don't, any of the people that comes to our group, they don't say anything about clinical trials. And this is like, 15 years later, you would think at least one would say, oh yeah, I did a clinical trial, or they offered that to me. So
But do you think the environment is more open for it now, for clinical trials? Do you think it's more of a receptive environment now for clinical trials?
If if I had to say, I would say that when it comes to people of color, we still, we still kind of turning our nose up when we hear clinical trials or research. But I think a lot of that just comes from, and this is what I call like the Facebook education. We read a lot of stuff online, or we hear our friends talk about stuff, and we say, "Oh no, that doesn't work for me." Instead of doing our own research, or
Mm-hmm.
talking with our providers about different options.
Mm-hmm.
And so that's why I really enjoy the work that I do, because I can go in and I can talk to people that look like me, or who, have the same lifestyle as me, and I can tell them, you don't have to make a decision, but I want you to have this information so that when you do make a decision, it's an informed decision. So yes.
Okay. Also, I have a question. Is it age specific as far as clinical trials? Are you looking at, well, this is a 15-year-old or this is a 70-year-old? Should we offer this? Is it more, well, 50, yeah, we'll offer it. If they 70, oh, well, they ain't gonna live too much longer no way, so why even offer it? I'm just throwing that out there, Is it age specific to offer clinical trials to
Yes,
people?
ma'am. Like I say, each trial they're different. Here in adult oncology, most of the time it's 18 and up. There's no end
Okay,
cap of the age. So
okay, all right.
Well, that's good to know.
That is. Mary
That
says,
gives us
are the
a little.
clinical trials free?
So most clinical trials are paid for by the sponsor, the company that is putting on the clinical trial. Anything that is asked outside of standard of care treatment will be covered by the clinical trial. So,
And
for
I'm curious.
instance,
Go
if
ahead.
they're asking, they would probably like supply the drug. If
Mm-hmm.
they're asking for any other additional like scans, CT scans, blood
Mm-hmm.
draws, they would cover that.
Oh, okay. That's good to know.
Yes.
That's good to know.
So this wouldn't really have anything to do with if they had insurance or not had insurance. Is
No,
that right or wrong?
no, we don't look at that part in the clinical trials. No.
Oh, well, that's good too. I
Hmm.
mean, because sometimes people be afraid if they don't
Yep.
have insurance, that's the first thing
Right.
come out of their mouth. I don't have insurance.
Yeah.
Absolutely.
But I
Absolutely.
guess not getting a clear understanding, that could be too.
And we've also heard patients say that they feel like once they start the clinical trial, they have to stay on it for the end of the trial, but it's not. It's completely voluntary. At any time you don't want to be a part of the trial, you can just let your provider know, and they can take you off the trial.
And for as far as the trial itself, the treatment, can you just give an estimate? Is that for 6 months? Is that for a year? I'm just throwing that out. How the term, how long?
Um, like I said, each trial is different,
It
so
Okay.
depends on.
it's hard to say. Yes.
But what's the longest, if you had to say, you're on a clinical trial for pancreatic, would that be a year treatment? Or that still just depends on the stage?
It depends on
Other
the stage, also. Yes. Yes, ma'am.
Because you
because
have
And when you
to
say,
think, when
go
you're on
ahead.
clinical trials, you have to think sometimes they're testing treatments or to get rid of it, to diagnose it, to get rid of it, to treat it.
Mm,
And then sometimes they're testing like for breast cancer, someone going through chemotherapy, they're testing like medication to ease symptoms of chemotherapy. So it depends on what
mm.
treatment they're offering, and how long they have to test that for.
And that
I
was going to
think
be the next question. What are the goals for the outcome? Go ahead, Gloria. I'm sorry.
no, I was just was just off my head.
Go
So
ahead.
I'll come back. Go ahead. Oh,
Go
it's so
ahead.
much to ask,
It is. It is. This is an interesting subject. It really is. I never knew how clinical trials are ran and what it, specifically what it is. And I was just curious, what has been the success rate um, with the clinical trials with certain cancers? But you might not have that information. But I'm just curious, what has been a successful clinical trial that went on to really be a good treatment that's been successful as far as the history of clinical trials?
I can speak a little on that. When I first started here, the Research Institute, I worked on a clinical trial. That was maybe 8 years ago. And now that drug is standard of care drug. That's the standard of care for that cancer type now.
Oh, wow.
So yes,
That's good.
yes.
You work in adult oncology, or you work in pediatric? Or
I'm in
both?
adult oncology.
Okay. That's
Wow.
good to know. Wow. So it's worth the time to invest in it for the future. Mary says, do you work with your PCP or only the trial physician or both?
I work with the oncologists, which they're investigators on the clinical trials.
Mm-hmm.
I think, is she asking from the patient perspective? So if a patient is on clinical trials, would they still see their primary care provider? Is that what she was asking?
I think that's what she,
Yes.
yes. Mary said yes. Okay.
Yes, I mean, I mean, Stacy could probably speak a little bit more to it, but I think anytime you have any type of specialty care, you should always let your primary provider know,
Mhm.
because they want to keep track of what's going on with your health as well.
Absolutely. 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 Wow, that's a lot of information, but you gave me a little bit more clarity on it and how it works. Gloria, did you were getting ready to say something, and I'm sorry I interrupted you. Go ahead.
And I don't know what I forget what I was gonna say. I think I was gonna ask about the medications for breast
Mm-hmm.
cancer. Have they came up with clinical trials that were they're they are a little less harsh, because I know the chemotherapy, it's very harsh on the body. I
Mhm.
don't know if they've come up with something new. I did it, like I said, I did a clinical trial, and I think mine went well. But I'm just wondering today, do they have anything um, that they give the patient to help with the nausea and the hair falling out? Is it just still the same routine that depend on the patient and they stage and cancer? Does that make any sense?
Yeah, yes, it
I'm
does.
just baffling.
It depends on the treatment that they're receiving, if their hair is going to fall out or what clinical trial. I know some clinical trials now are using immunotherapies, which are a
Mm-hmm.
little different than chemotherapy. I've heard patients say it's a little less harsh on their body.
Mhm.
Mm-hmm.
So
But
it
that's
kind of boosts your immune system, kind of, to fight the
Mm-hmm.
cancer.
Mm-hmm.
That reminds me of something that I heard as well. A lot of communities or a lot of patients think that when they're on clinical trials, they can't stick with their traditional health methods. In different communities, they find massage therapy to be helpful,
Mm-hmm.
or aromatherapy. And I just want to highlight that that's a myth. When you're on a clinical trial, you don't have to cold turkey everything that you do to make yourself feel better. Clinical trials are meant to be incorporated with your daily routine and to test and see how they all work together. So
Absolutely. Absolutely. Okay. Any more questions, ladies? Gloria,
Lois, you have
Lois?
anything?
Yes, I do. I do have a question. In this regard in pancreatic, cancer. One of the things I think is Eric, how do you, Eric?
Erkwandra, but you can call
Yes, please.
me.
Okay, I had taken a note that where you said that you got in that you're involved with community outreach. When you say you're involved with community outreach, basically what does that mean? Do you go to different areas or community centers, or so you do?
Yes, ma'am. So multi-care, when this project was started, they wanted a way to connect with the BIPOC community. And so they created this role for me to go in and for me to not only educate, but to learn from them as well, to learn about the needs or to kind of get a understanding of why BIPOC participants did not want to participate in clinical trials, or why not that they did not want to, or why they just weren't. So I, as well, so as long as, excuse me, while I'm going in and taking information to them, teaching them more about clinical trials and raising the awareness of that, I'm also learning from them as well. So like I said, I learned about the myths or the mistrust that they have and how we can work on that as a healthcare system. So it's been great so far.
Okay, well, good. I'm glad to know that you are doing that. One of the things, by you going out, do you find a lot of them that are actually reluctant to really want to participate in?
I think a lot of the community members that I'm talking to, they're kind of more so like, well, why do I have a need for that? I already, my community, we do this to when our health gets bad, we go here. Or, if we were diagnosed with cancer, I'd rather have this option versus this option. And so that's how my message has been received. But I've been persistent in letting them know that I'm not here to force you to get on a clinical trial. I'm here so that you have this information so that when, if, and in if and anyone that or if you just so happen to ever be diagnosed with cancer, you remember the information that I brought to you and can say, hey, this hasn't been brought up at my doctor's note or at my doctor's meeting. Let me bring this information to my doctor and talk to them about it. So that's what my role is, just purely based on raising awareness and educating.
Okay, thank you. I have a question for Stacy. Is there time for another question? Okay, Stacy, you mentioned the clinical trial, and I think it was either Gloria or Anita, like the age, but really a lot of the time, some of the physician, your primary, they look at a person age, and it's kind of like they might determine, so, well, this isn't for you. I'm in reference to my sister-in-law who had pancreatic surgery, who now we just had it like about 4 months ago, kind of find out that it is back. But there was never anything when she initially went in, there was nothing about, any trials. We're going to do this first. It just went into basically that we're going to do these treatments and that's it, and this surgery. So I know you say there is no age discrimination, but actually I feel that there is. Has you ever had anyone that are like in the 78s in that age group who really felt that way?
But like I said, each trial, there's criteria. So there might be a certain criteria for a patient to, their lab value has to be a certain lab value. And that patient, even though they are 75, 80 years old, they might just not meet that criteria because of lab values.
Okay, all right, thank you.
Is that what it's based on, mainly the lab values? Or is it all of it as a whole? So she has pancreatic. She's had surgery before. So would that disqualify her because she has had some type of treatment before coming for a trial?
Not necessarily. I would tell her to look and see what is available at her healthcare system or in the surrounding community. You can always look on the healthcare system's website to see if they have research department there, and also clinicaltrials.gov that has all of the clinical trials across the nation.
Stacy, could you repeat that again? Clinical what?
Clinicaltrials.gov.
Okay.
Okay.
Yes. And there's some drop downs in there. You can kind of put in like your cancer type that you're looking for. It's easy to navigate through that site.
Mm-hmm.
And if you're just looking for more information just about cancer or cancer research as a whole, you can go to cancer.gov and that'll take you as well to the National Cancer Institute website.
Okay, thanks.
Great.
Okay. Any more questions, ladies? And I have questions for both of you. What would you like, what would you like to leave with us today? And Stacy, what would you like to leave with us today? And you can start first.
Yes, ma'am. If I can leave anything with you all and with your listeners today, I just want to let you guys know that it's okay to feel how you feel when it comes to your healthcare system, but don't let that stop you from getting the information and for advocating for yourself. You know, we all have the right to the same information as anyone else. So if we have to fight a little bit harder for ours, it's unfortunate, but don't let that be the reason why you don't.
Absolutely, absolutely. Stacy, what would you like to leave with us today?
Like patients, just advocate for yourself. You know your body more better than anyone. Um, Feel free to always get a second opinion. You don't have to go off of what one provider
Amen.
says. Yes, if you don't agree with what they're wanting you to do, feel free to go get a second opinion.
Absolutely.
Mhm.
Thank you. That's
Gloria,
so true. No, I just want to thank both of the ladies. They brought a lot of
you
information to us.
did.
Mhm.
We appreciate them coming, and
Yeah.
hopefully you guys
Yes.
can come back again.
Thank
Yes,
you.
definitely. Absolutely. I
Thank
learned a
you.
lot. Lois, did you have
Yeah.
anything you
No,
want to?
I've asked my question, but thank you guys. Thank you.
Thank you guys. It takes a community, so I'm really grateful that.
It does. It does.
Exactly.
Well, on
Exactly.
that note, wow, a lot of information. And Mary says, thank you. Great information. We
Yeah.
appreciate your time and effort of coming to the Mahogany Circle show. Boy, I learned a lot.
Yeah.
And we're going to keep in contact. Maybe we could do this at least once a year,
Yes, ma'am.
and
Yeah.
you guys can come back because it seems like it's constantly evolving. It's constantly evolving. It's learning more. Like Gloria was saying, even with the breast cancer, mine was in 2010, hers 2009. Everything is changing. This 2025.
Yes, ma'am.
And you young ladies are right in the middle of this change and you seeing it. And then you can come and share with us so we can share with others. So being a cancer group, that's our aim, is to be informed and to know the resources in the community and to share with the community. But I like what you both said. Be your own advocate for your care. Absolutely. That's it. That's it. That's what it's all about. So once again, we say thank you to you for coming and sharing your information. And I'm so proud of both of you. I'm just glad in this field we got the young people coming behind us. They doing their thing and they sharing the information and doing the work. So one last call out. Anybody else have anything else to say? Gloria,
I'm good. Thank you. Have a good rest of your week.
Thank you.
Lois,
I'm good.
Mary, she's our producer.
She's off.
She don't have nothing to say.
Oh, she's a great everyone.
Oh, she says great. Okay. All right, Ian, Stacy, one last time, ladies. Anything else you want to share with us before we sign off?
Do you have a web address or email or anything like that you'd like to leave? You can
Yes,
Yeah.
I
put it.
can put it in the chat. I think it'll pop
Yeah,
up. Um,
Okay.
that
if
would be
you're a
great.
community organization and you want to get this information out to your participants, please feel free to reach out to me.
We
Absolutely.
will.
Absolutely.
Yeah. Thank
Okay.
you.
E has put the information in. Erkwandra.joseph@multicare.org. Erkwandra.joseph@multicare.org. Once again, you have been listening to the Mahogany Circle Show podcast. Our guests have been Erica Wandra Joseph and Stacy Macon from Multicare, and they have enlightened us and shared with us a lot of information about clinical trials. So this afternoon, have a great day. And those of you who are mothers, please have a great Mother's Day weekend. So this is Amita Hassan
Gloria Bryant.
and Gloria Bryant, my teammate, and Lois
Lois.
Johnson. We all want to say thank you. And this has been a great podcast today. Boy, a lot of information.
Mm.
And God bless you, young ladies. And we're signing off. We'll see you next month in the audience. Thank you for tuning in to the Mahogany Circle podcast. Have a great day.
Bye.